Hello, everyone. My name is Avinash, and I'm a recent graduate of the Ontario College of Homeopathic Medicine, Toronto. Today, I'm delighted to welcome my guru, a master of vanishing act, as she continues to dilute her steps to the point that the dance becomes so minimalist that we are left staring at an empty stage without matter and yet call it a percussion of the highest order. Well, she may prefer to call it a succussion of the highest order, for our guest today is a professional dancer turned homeopath. Head of Homeopathy and Director Teaching Clinic at OCHM, Beth is a Bachelor of Arts graduate from University of Pennsylvania and Master of Fine Arts in Dance and Choreography from Temple University. She was a professional dancer until trained in homeopathy when she began her practice at the turn of the millennium. She has also done teaching stints at University of Toronto. Welcome, Beth. It's a pleasure and honor to have you with us today.
Asking me to do this, Avinash. It's a true pleasure on my part.
Awesome. So, Beth, today we'd like to enter into the mind of a teacher, specifically gloss over questions which normally don't come up during the curriculum, trying to
Mhm.
unravel some of the challenges of teaching homeopathy in today's environment and passing on the wisdom of Hahnemann, Jeremy Sher, Sankara, and the likes to posterity. So, let's start off with a simple thing. How did the balance tip over in favor of homeopathy for you?
For me personally, how did the
Mhm.
balance tip? Oh, well, I came from a medical family. And as you mentioned, I had a career as a dancer before I changed to homeopathy, which was a truly fortuitous change for me. And actually less surprising of a change than one might think, insofar as I think that dance is very much about human expression. And what we're really trying to do in homeopathy is understand individual human expression at a very nuanced level. And certainly the discipline I learned in dance and the drive that one needs to have to succeed in that profession has served me well in homeopathy. Um, but I experienced homeopathy for the first time as a patient in my third pregnancy when I had some complications, and I was given a extraordinary recommendation of a complete bed rest for the last 20 weeks of my pregnancy. And with two toddlers already on the scene, that was a virtual impossibility. And homeopathy worked some magic. And it made me really interested and really pay attention at a time when I was starting to think about what next in my life.
Wonderful. That's quite some journey. So, how do you think the perception of homeopathy has changed in North America in last 2 decades? Does the world think that we are still stuck in a slow motion, cautious waltz, or has the tempo picked up?
I think it's a little bit of both. I think that there is and I actually will say right away that I think Canada is different from the United States. Um, in Canada, we have this wonderful free healthcare system, and people are very much of the mindset that their healthcare, all healthcare should be provided by the state. And so as long as the state is not involved here, of course, the state's involved in regulating homeopathy, but not in providing homeopathic care. People are cautious. They're very reluctant to spend their hard-earned dollars on something that they think can be addressed by a free system. In the United States, I think it's very different. There's much more of a kind of renegade mentality there. There's much more distrust of mainstream institutions. There's much more of a desire to push back, try other things. And if you're paying for it anyway, you might as well try something that is more ideologically in keeping with your own belief systems. So I think North America is hard to clump together for that reason. In Canada, I do see a gradual and increasing skepticism with what mainstream medicine has to offer for a number of reasons. One is that people have trouble accessing this free health care. There isn't enough doctors. There aren't waiting lists are long. People get frustrated and they want to look elsewhere. The medical system, as we know, can be very formulaic. Everybody with the same diagnosis is treated the same, and people often feel like they're cogs in a wheel and they're not seeing the kinds of improvements that they would like to see. Rather, they're seeing more and more and more pharmaceutical medications added to their regimes, and they're increasingly dissatisfied with that. So I think that is working to a certain degree in homeopathy's favor. I think that if you look at people who are skeptics of homeopathy, um, they will acknowledge, if nothing else, they may say none of it is real, but they will acknowledge that we have a very good bedside manner and that we know how to reach a patient, how to communicate with a patient, how to listen well, how to give patients our time and our attention. And that is very, very appealing to people. People they're begging to have more than 10 minutes with a health professional. And homeopaths do that, and they don't do it just superficially. They do it really, really, really well. And so once people are exposed to homeopathy or hear about it, they become much more interested and much more curious. I do have concerns, and we may address these more fully later about homeopathy in Canada's uneasy relationship with mainstream medicine. And from a personal point of view, I think it's very, very important that we stay in our own lanes. I no more want to hear a medical doctor talking about the efficacy of homeopathic medicines than I should be talking about their medications, their procedures, their protocols. So I think that what we need to learn as these perceptions change, as more and more Canadians reach out to homeopathy, that we very assiduously stay in our lanes. We respect each other. We don't make commentary. We don't sort of uh, interfere with what the other modality is doing. And we try to learn a way to work side by side, which ultimately I think will create a web of care that will serve more people and create less dissension on all sides of the discussion.
It's interesting to bring this point out because, in our own experience, we do come across several classical doctors who have turned homeopaths and they have
Mhm.
seen both sides of the coin and they're able to complement only keeping the patient's well being in mind, not really taking sides either of their previous profession or their newfound love with homeopathy.
Absolutely, absolutely. And I will say we do see allopathic doctors turning to homeopathy because they know that they're often not curing people. They're
Mhm.
fixing a problem, but they're not curing at a deep level. And I see this most commonly with pediatricians.
Mhm.
Pediatricians who see young patients with chronic issues, and they recognize that what allopathy offers them is lifetime pharmaceutical dependence as opposed to a true deep cure. So I do see allopathic medicine, doctors turning to homeopathy. I'm not sure I've ever seen a homeopath
Turn into
trained
it.
as an allopathic doctor. I've seen some homeopaths trained as a naturopathic doctor,
Mhm.
but not as a allopathic doctor per se.
So I had this question pegged slightly later into the sequence, but since you're talking about it, it's very, very pertinent we talk about some of the challenges in starting patients on homeopathy, especially early in the disease cycle. Or where do you see the challenges lie? Was it when they have run out of options, or is it very much early and they really don't want to try anything but allopathy? How does
Right.
it play out?
Well, we see both. We see both coming to us. We see people who have, we use the expression when I train, teeth, tried everything else, try homeopathy. So our teeth patients who have run out of all other options, and often by the time they come to us, they are quite ill. And so often I look at some of these patients and I'm thinking of some of the ones we're seeing in our clinic now and just feel so sad that they didn't find their way to us sooner because we have so much more than palliative care to offer. So that's hard when we get people, as I say, the teeth patients. Obviously, it's lovely when people come to us early on, when parents notice something that's a little off in their child, when there's a little bit of a change of function. And I think one of the things that's really difficult to teach our patients is you may have come because of this menstrual dysregulation, for instance, and I'm just making that up as I go along. But there's so much more we can offer. And I do find that it takes patients a while to recognize that it's not just physical pathology that we're treating. And I think that patients come in, and I remember my first experiences with homeopathy, and while they were beneficial, I was very puzzled by the whole process, by what to expect, what to look for. And I think it's essential that we educate our patients, because this is not green allopathy. It's not you take this medicine for this and you take this medicine for this. It's something altogether different. We're also asking patients to be involved in their healthcare in a way that they're usually much more passive. They're lower on a sort of they're the ranking of authority. We need our patients' self-knowledge. We need to hear what our patients say. We want to know their opinions. We want to understand how they understand their disease. So patient education is so important. Teaching patients what to look for. Okay, you may have come in for this, and it may still be there and perhaps a diluted form, but so much else of your function has improved. It doesn't mean that what we've done hasn't worked. It means that we're going in a linear process. We can't control that process necessarily, but we're seeing overall generalized improvement. And in the end, that very first concern, that first presenting complaint will be addressed eventually and resolve itself once we start seeing this unrolling of symptoms and the improvement on a global level.
And that brings to my mind a couple of memories from some of the cases where we note the top two or three complaints that a patient comes to the clinic with. And then in the follow up, we suddenly ask them and say, no, nothing has happened. And after
Nothing
five
has
minutes of
happened.
drilling, you realize the patient is saying nothing has happened because that problem went away. They don't even remember there was a problem.
A
And
hundred
then
percent.
and then you need to remind them, do you remember this was there, that was there? Oh, yeah, now that you tell me, I don't think I've seen that. So, yes,
Right.
it's a full circle working on your whole individual. And coming to think of it, you said it's difficult teaching our patients how to live with homeopathic protocols. How easy or difficult is it to teach students? What is the most difficult part of homeopathy that you have come across in teaching students?
Hmm. Well, I often say there are some things we can't teach. We can't teach empathy. We
Mhm.
can't teach curiosity. And it's very, very difficult, but not impossible to teach professionalism. The skills of being a homeopath, we teach and we teach very effectively, I believe. But students who come to homeopathy education without a genuine interest in human beings,
Mm.
without any real curiosity about people, and without any real sensitivity and empathy for people's conditions. That's very, very hard for us to work for with. Very, very hard for us to teach people how to sit with people who are in pain. Alongside that, and this brings up something that I've been grappling with a few of our students recently, is it's very hard for our students who have their own painful life stories, perhaps in living color at the moment, push patients to explore deeper into themselves. Often we don't want to hear other people's pain or present other people to bring up things that might be painful because we're afraid of our own internal pain. And that is a really, really difficult thing, and it's also why all homeopathic students should be in homeopathic care while they're going through the program, because you need to be able to not just separate your own issues, not just say, oh, yeah, I had the exact same thing happen. Nobody's had the exact same thing happen. You know, not to glom onto somebody else's story, but also not to be afraid of somebody else's story, but instead to approach someone else's story with an open heart, with curiosity, and with empathy. And get reaching that delicate balance is a really huge, huge challenge in what we do. And one of the things that I've noticed, and initially when I started at OCHM, I would look at a few of the students and think, I'm worried about this student. You know, they perhaps don't have a lot of academic background. They may not be particularly polished in their presentation. They may not have anything that apparently you'd think, oh, of course, they'll be a great homeopath. But often, some of these people become the best homeopaths. You know, the people who've had a career as a taxi driver and have spent their time talking to people, every walk of life, hearing their story, hearing what they have to say, letting people express themselves. That is great preparation for being a homeopath, even though there's very little that is immediately uh, sort of obvious about being a taxi driver, being a homeopath. One doesn't necessarily lead to the other, but that ability to talk to people, to listen to people, to have no judgment, to open your mind and your heart, that's what we need in good homeopaths. And it's the hardest thing for us to teach.
And would you place them, obviously I can hear you as you say, would you place them much more important skills as a prerequisite to entering into a homeopathic course than any other rubrics that you may be looking for when you are selecting students or admitting them?
Well, obviously, if you know how to do research, if you know how to write, if you know how to express yourself, if you have a certain degree of professionalism in dealing with colleagues, if you have, that is all, those are all hugely beneficial in starting a program like the program we have at OCHM because it is very academic. It's very difficult program. It's very intensive. So having the skills to get through an academic program like that is really important and really helpful, but it's not enough.
Mhm. So
Those
that
soft skills are essential as well.
so is OCHM, or in your opinion, at industry level, other institutions imparting homeopathic diplomas, are they putting these toll gate to look for the soft skills, and only if you clear that, your other skills will even be looked at? Or it is something you take a bet on and you hope that the person is empathetic and
You know,
open?
you have to do this on a person, an individual basis, a person to person basis. Why are they interested in homeopathy? What do they have to bring to the game? What are they hoping to achieve? How diligent are they? You know, how we do know that we'll often say to students when they're interviewing, this is not an easy program. You need to be ready to work hard. I'm sure you can speak to the fact that this is not an easy program. And students say, I'm not interested. I want something that's quicker and easier. We'll say, you're probably not right for the program if that's how you feel, but you also will not be prepared to be a homeopath if you go to an easier program. There's no easy way to learn homeopathy, and there's no easy way to do homeopathy.
And what do you think is the biggest misstep when they graduate and be out on their own as a homeopath? Where do you think most people have gone the wrong way or the risk was highest for them?
Right. Well, our students come out of our program because of our very, very active teaching clinic. Our students graduate with an enormous amount of clinical experience. They have had usually up to 1,000 clinic hours sitting in front of patients, taking cases, analyzing cases. That really prepares them for almost anything that comes their way. But a lot of them, but our clinic is collaborative and there's support there. And there's always a supervisor present. And there's always another homeopathic student present. And so there's much more of that collaborative energy. We all love the collaboration. We all say, boy, when we graduate, let's keep doing this. But of course, that's not realistic. And so I think relying on your skills, being independent, having the confidence to know that all those 3 years of academic training and all those hours of clinical internship have truly prepared you. And of course, we're always there to pick up pieces if people do need problems, and we've set up other structures for students to rely on each other. But it is a leap leaving a school, the nest of OCHM to be out on your own. That's for some students. And sometimes that, and sometimes the need to make money immediately prevent obstacles for students really launching a strong practice.
I think that really calls for a lot of patience and taking one little step at a time. Because,
Yeah.
as you rightly mentioned, I really don't think homeopathy is about money at all. Yes, there is a trade-off. Even patient, if you're giving free advice, won't even value it. But then the first quality is helping another individual because you can see that the person can be helped. So first thing has to be on those lines, then really pushing the accelerator on how much returns have I generated on my investment.
Fair enough, and I see your point, and it's a passion project for many students who have to go back to their full-time jobs. It's
Mhm.
really hard for them to start a practice, and people should be able to make a living doing homeopathy. Really, in a just and right world, we would make as much money as allopaths doing applying our trade. And so I do think it's important for students to know that in time they can make a living and they should be making a living and they should be charging for their time, but it's not a process that's going to start like that. It's going to take some time and it happens organically, but with good training, good persistence, good thinking about how you're marketing and reaching out to a community, our students, I mean, we are so clear from the very beginning that we are determined to prepare our students to practice.
So, in your experience, which are the modules that you have seen gone out of the curriculum versus which are the modules that you have introduced in the last couple of years to prepare the students better transition and be in sync with the real world?
Well, the truth of the matter is we haven't lost any modules. We've just added
Okay.
and added and added. We have taken some modules out of the live teaching and put them as independent learning. And that's how we um, started. There came a point. around 8 years ago when we started realizing that we really need to beef up this curriculum beyond the kind of standard homeopathic core curriculum, which sort of looks alike at every homeopathic school. We really need to go way beyond a core curriculum if our students are going to be prepared to practice in the real world. And so we haven't really taken anything away, but we have put some things into what we'd call independent learning modules, which, as you know, run alongside the in-class curriculum so that students can learn that core curriculum, but they actually don't necessarily need to learn it in a really structured learning environment. So we have really expanded our curriculum to include what most other graduates of homeopathic schools need to get in their postgraduate education. We want students to understand how to use Schulten's plant system, how to use the periodic table, how to use Yakir's plant system, to understand all of the new thinking, the new approaches, the vast number of remedies that are out there. We've changed how we've taught materia medica so that students have at access all 8,000 remedies and they know how to get to them rather than memorizing 50 polycrests,
Mhm.
which is typical in many programs. We want our students to know that they can use the most all of the remedies, the whole lexicon, the whole pharmacopoeia of homeopathic remedies in treating patients. And that's really important that we uh, have a curriculum that shows students how to access those um, unknown, non-familiar, never heard of before remedies because they might be exactly what your patient needs. We
Absolutely.
also have added, since, in addition to expanding that curriculum and, teaching students how to do detoxification protocols, how to do much more, um, everything's grounded in classical homeopathy, but to go from there because 21st century disease demands it. There's just no question. We need to go beyond, the small core of what homeopathy looked like 50, 100 years ago. We've also added what we call our enriched curriculum, and that's really fun. That's really exciting. We have speakers coming in, as you know, well-known homeopaths who come in and teach our students. And what's lovely about it is we include the larger community of homeopaths, not just in Canada, America. So it's an opportunity for our students to both hear some of the greatest minds in homeopathy teaching them, but also to hobnob with people who have already graduated from our school and people who have really established practices. And it creates a really nice atmosphere when you have teachers and supervisors and professional homeopaths and students at all levels, all in one space together, learning from a great thinker. And so that is, again, something else we've added. We call it our enriched curriculum. So yeah, the program keeps growing. We haven't taken anything out actually. So it's becoming a little bit thick around the belly, but it's still, and I think again, you will attest to the fact that you know a lot by the time you finish.
Definitely. And looking 5 years into the horizon, do you foresee something being added, something which you see on the horizon? Yeah, next 5 years we'll also be talking this.
Well, who knows what great new book, a great new theory is going to come out there. Um, I always aware of what's coming out. I want to see how kind of solid and bona fide it is, how much clinical evidence there is, that it's not just purely theoretical. So I can't say anything in particular, but you know, the homeopathic world is our oyster, and we will keep going out there and looking for wonderful new thinkers and approaches as long as they're grounded in classical homeopathy and also grounded in really good clinical evidence of their efficacy.
So there's this buzzword going in all the industries, which is AI. So how do you think
Oh,
AI is going to play out for homeopathy?
well, AI is not going to go away. It's here,
Mhm.
and we need to learn to work with AI. The bottom line is that AI is a machine, and it works with logarithms, and it works with what is common and what is repeated often. And we're kind of the opposite. We aren't
Mhm.
caring about what is common. We want to know what's unique and characteristic in each patient's presentation of their dis-ease. And so, AI is a problem in that way. And it has creeped into with students' work. And when I mean, I will not allow AI for on exams, for instance, but it really waters students' work down. Their AI hallucinates, AI makes stuff up, AI is lacking in nuance, AI puts emphasis on things that should not be emphasized, and it really leads students down the wrong garden path. And most of them figure that out eventually.
Yeah,
I fear mostly about AI. I think our students, like any good students of any human study, will learn that a machine cannot replace a human brain and a human heart. But what concerns me almost more about AI are those home prescribers who get onto AI and say, what should I take for my cough? And come up with stuff that just doesn't work.
absolutely.
Alistair Gray and Denise Stragus did a study on AI and acute prescribing, and AI only gets the remedy that the professional homeopaths have had success with 12% of the time. And that is an astonishingly poor rate of success. And so the last thing we want is the general public saying, "Oh, homeopathy doesn't work. I tried it. I've tried it for my cough. I've tried it for this, or I've tried it for that." Well, you've tried it because AI's been your prescriber, and so no, it probably won't work, or at least it'll only work 12% of the time. So that is not, it's not good for um, imbuing people with some confidence in what we do. And of course, people don't know the difference between they won't even know whether it's AI prescribing a remedy. They don't even understand. They don't know the difference. So, it is a scary thing, and we do need to be on the alert for it.
In fact, I have come across some of the allopathic doctors as well who are kind of trying to drive side by side. And they say, you know what? If you are scared of this particular medication, here is a homeopathic and you can try this. But they run the same risk. They are not individualizing it, they're not following the classical approach. It's like homeopathy for cough, homeopathy for burns kind of an approach, which obviously is not
Right.
homeopathy. And
No,
then that
no.
brings me to a last topic here. What lies ahead for the future of homeopathy generally? Is it going to get the spotlight on the center of the stage, or will it be just watching a very elegant, slow motion exit towards the green room? Coming back to your background.
My entrance. Um, oh, I do hope not. I really do hope not. Um, you know, I think I see some uh I see some danger signs for us moving forward. AI, of course, we've covered that, is one of them. The education of homeopaths, new homeopaths, is of concern. People need a superior education. They need to be committed to working hard for 3 years. They need to know that their stuff, basically, if they're going to be advocates for homeopathy, if they're going to be able to, you know, spread the good word of homeopathy. That's really, really important. Here in Canada, we're working hard at getting insurance companies to cover more homeopathic care, and that will be enormous for sort of homeopaths homeopaths having a greater exposure and people having a better experience with homeopathy. Um, I do feel that the tension within the two camps of the homeopathic community is a really, really big problem. And for my entire career, it's been a problem, but it's becoming more and more of a problem as certainly in Ontario, it's becoming more and more of a problem with registration because there is a camp of homeopaths here who want to do what we call controlled acts, who want to be called doctors, who want to do physical examination, who want to step on the toes of allopathic medicine. And the mainstream doctors are not going to put up with that, and we will be smothered. And that is probably my biggest concern for homeopathy generally. And I do think it's a shame because we have something so beautiful to offer, something so effective, something so gentle and so extraordinary in its reach that for it to be smothered because really it's the greed of the ego that's seeking to do things that we're not really trained to do, that we shouldn't be trained to do, that we don't see enough patients to do well. And that is probably my biggest fear for homeopathy. But at the same time, homeopathy holds a golden light up there. And if the good word of success can be spread, we have a great future. Um, we really, really offer people something that is unique and wonderful and so effective.
Awesome. That's really very, very inspiring because having invested so much of time and passion, all the students, all the practitioners, they would ultimately hope to vouch for a healthier world, for a happier world around them, which homeopathy has definitely a lot to offer. There's no
Absolutely.
competition out there. There are complementary medicines and each to his own. And ultimately, we also believe that it's a patient's choice. We are not trying to prove a point even to the patient. If you are comfortable with whatever works for you, I think that's the way to go. Thank you so much, Beth, for your time today. Got a lot of nuggets,
Thank
and we
you.
are hoping that this will spread the good word around. And thank you once again. Looking forward to meeting you in near future. Bye bye.
Okay. Thank you, Avinash. Much appreciated. That was a pleasure.
Thank you.